There's a saying by Hippocrates, and that is, don't tell me about the disease the man has. Tell me about the man who has the disease.
I think adult day programs provide a very necessary part of the whole healthcare delivery system, in that we take care of people during the day who are still able to remain living at home but need a little bit of extra care.
Adult day services help seniors to live at home if they want to, and they help families to keep the family together.
You know, I was overwhelmed with taking care of her. In my mind, it was nursing home or at home. So when I found that there are places where you can take them for a few hours, I was greatly relieved.
The services that are provided through this program are many, and I did all of those services prior to her being part of this program.
It gives me room to breathe. You know, during the day I can go and do errands, I can go and do the things that I need to do.
Without it, we actually wouldn't be able to function any other way in our own personal lives.
These services benefit both the caregiver and the participant. The caregiver gets a little bit of a break, knowing and having that peace of mind that their loved one is safe and in a place that's really beneficial to them.
When they come to the center, they have a chance to be themselves. They have a chance to be a friend. They have a chance to be a learner. They have a chance to participate in their own health. They have a chance to continue living with real quality.
Nobody wants to know that they're disabled. They want to know that they're vital and involved, and that's what we try to accomplish here.
See, what you all giving us everything, not something. Y'all putting everything into a senior citizen's life.
A great day for them is they can go out of their home to see the blue sky and also come here to have some good, fun time. So safety and happy and healthy.
My mother is 96 years old. Slight Alzheimer's is what she's got, but it gets worse. And you suddenly realize that your mother is not immortal. And there really is a shift where you become the parent. It's hard in that respect to just watch the decline. You just wish they could always be the way they were. I asked her primary caregiver if she would benefit from a daycare center of some sort, and she said she would.
In Alameda County, we have a total of 15 programs. All of the programs include transportation to and from the individual's home, hot lunch, a little bit of exercise every day that's appropriate for their level of fitness, and activities that are designed to keep them engaged both physically and mentally.
I think the dancing is such an important part. It's amazing the range of people that attracts. There was one person up there, she can do nothing else, but she can click her fingers to the rhythm.
Being around people who are experiencing some of the same things that they are is, you know, a tremendous support.
To me, they're more than just participants, they're my family. I see them as my family.
I don't know if he even knows anybody's names, but he knows that he feels comfortable here, and he knows that he knows people, and they will nod to him, and they'll, you know, worry about him if he's not here. And it's really important to him to have that feeling of belonging someplace.
Many of the family members tell me that on Saturday, their loved one gets up and wants to know where the bus is. So they must like it here because they want to come here even when we're not here.
Before this center, that we really worry, you know, because she hates this, she hates that, and pain here, pain there. But now, I'll say it's like this, she's back to normal.
She likes the staff, and she likes the people she's with. I mean, you just see her, she's smiling all the time.
She comes home and she'll tell me about different people. She would tell me about a lady who was always complaining because her knee hurt her so bad, and my mom would say, why don't you have your knee replaced? I had mine done, and see how good mine is now. So.
In the background of that community, there also getting health services, they're getting practical personal care.
And so when they're here and they're having a nurse that's taking a look at them regularly and communicating with their doctors, you know, there'll be a lot less hospital visits, a lot less urgent care visits.
Instead of them being home, they're in the care of someone that understands what the needs are. And it gives me an opportunity to get away from the house.
That I could go shopping and not rush home because she was alone, that I could go for a doctor's visit. It wasn't that I went on wild trips or something. It was the small things that I could not do for many years.
We're able to claim some of that mother-daughter time again, because I'm not responsible 100% of the time.
The caregiver is a very important person to the welfare of the individual, and we realize that. So when we even count our clients, we say we have a participant and we have a caregiver and we have a family.
The caregiver support group is a group of caregivers. They share feelings and support each other.
You find that everybody has situations that they go through with whoever they're caring for, and they're not all the same, and some are similar, so you can relate.
I really realized why I had been feeling so tired, you know, because I was working this like triple shift job, really.
We have educational sessions regarding disease and regarding clinical skill, and during the caregiver group we train them how to cope with their feelings, how to deal with the problems.
It gives us ideas on how to handle whatever develops at the house or when we're out in public.
A lot of our caregivers are so busy, so I do a lot over the phone. My role is to make sure that people are connected to all the resources, helping them manage their in-home supportive service worker, help them manage the bureaucracies of insurance companies like Medi-Cal and Medicare, and then to help with some of the mental health issues and psychological issues that will come up for people and their families.
There are a lot of emotions, and it's important to understand that that happens. You just have to build a support system where you can be able to have time for yourself and understand what's going on with you so you can better support that person.
My mother got her empathy from her mother, and she's always enjoyed getting people to join in. That's just her. I'm not sure that her short-term memory loss is arrested, but because she's there and she's talking with other people and she's singing and she's dancing and she's doing the exercises and everything, it's made her stronger. She's frail, but she's still able to get out and work in her yard, and that's the most important thing to her. So I can't help but think that going to BACS makes her stronger and more wanting to be in the world.
The Adult Day Services Network is the association of the 9 agencies in the county, all not-for-profit, that operate adult day programs. The network brings together the providers across the county so they can work together to strengthen their own organizations and their own programs.
For caregivers, we offer a number of services. We do outreach and education in the community about what adult day programs are. We have a website with information about caregiving on it and information on each one of the adult day programs in the county. In addition to caregivers, we provide information to doctors, hospital discharge planners, social workers, anyone that might help support a family as they first begin taking care of either a spouse or a parent that needs additional help. We also have a free telephone information line. One of my roles is to help people discover which 1 or 2 of these 15 programs might be best suited to their individual needs. The other things I help people with have to do with other resources in the community that help them take care of frail elders, such as transportation, meals, low-cost legal services, or other kinds of support services that will help them keep somebody at home. I hear in people's voices that somehow they feel like they should be able to do this all on their own. And yet what we have found is that caregivers' health begins to suffer if people try to do it on their own for too long.
They need to have a place to vent the feelings and to support each other.
The value of adult day services is a very individual value for each person that's served, but it's also an important one for the community.
My goal for the participants is that they remain connected to their families and to their community as much as they are able and for as long as they are able.
Families continue to play a vital role in the care of their loved one when they're coming to an adult day program, and hopefully they can provide even better care as a result of their loved one coming.
Everyone is so patient and so kind and so willing to take care of any circumstance which comes across.
There's a lot of wonderful, warm, generous, sweet care that's provided for people, and there's a lot of connection that happens that really enrich people's lives and put a twinkle in their eye.
And I have a lot of fun here. I like to come, and they're good to me.
Each person who comes to an adult day center is respected for who they are, they're valued, they're part of the community, and they're treated with dignity. And that in itself is healing.
I'm happy. I'm happy and I haven't been in my life, and I'm 72 years old.